we have a very interesting topic, which was just announced on TechCrunch only a few hours ago, which is that 23andMe announced today that it has formed a partnership that will actually see the results from all of its genetics data now create a pharmaceutical product. And I would be curious for any of you watching in the live stream today, hit me up with your thoughts on this, both good and bad. I mean, is this a privacy concern, or is this going to create major happiness for people and a whole new slew of business opportunities? So let's go right into it. So, we are looking at this article from TechCrunch today. And what it says is, congratulations, 23andMe users. Your genes are finally helping the company make drugs. Pretty funny. When I read this headline, I actually came in with a pretty negative tone. I'm not going to lie, because of the potential privacy concerns. But as I started reading it, it actually showed that the specific research and drug that's going to be created is actually a treatment for something that is or near something that I have, which is seborrheic dermatitis. So, sometimes my skin will kind of like get all red and stuff. And this is a cure against that. So, what it says here is that all of the genetic material that 23andMe, and by the way, I'm going to go through this article first. We're going to kind of look at what just happened here. The fact that, genes are now making drugs from a data mining service. And then we're going to talk about what's going to happen more broadly in biotech and opportunities that might exist here, both for investors and entrepreneurs. So we're going to be talking all about that, as well as some of the potential moral issues that surround this. So moving deep into this, the article from TechCrunch starts out, all of that genetic material that 23andMe has been collecting is finally being used for commercial drug development, specifically dermatological drugs. Is that even a word? I don't think I've ever heard someone say dermatological, but anyway, dermatology. So the company inked an agreement with Spanish pharmaceutical developer Almirall, which concentrates on medical dermatology treatments for the development of dermatological treatments based on an antibody developed by 23andMe. And this article goes into the specific antibody, and it blocks small proteins known as IL-36 cytokines, which are linked to skin conditions, including psoriasis and lupus, and other inflammatory conditions like ulcerative colitis, inflammatory bowel disease, and Crohn's disease. And I know through friends of mine who have IBD, unfortunately, that this is a growing problem. A lot of it is really caused by external elements. Really, any sort of inflammation does have roots in external things that are happening. So it could be things that you eat. It could be just where you live. It could be pollution. I mean, you have to actually pinpoint what's causing it, and that can be rather difficult. So this is targeting a very wide range of diseases. And it's actually very interesting to see that it doesn't only limit itself to skin inflammations, but also these other, IBD, Crohn's. Very interesting. So this data all came from the 80% of the 10 million people. So 8 million people who have signed up for 23andMe and allowed their genetic material to be used for drug discovery. And so these are people who are opting in. I'm not going to lie. I'm a member of 23andMe, and I don't remember actually agreeing to it. So I have a feeling that it's a bit shrouded in legal mumbo jumbo that is really difficult to understand. And that could be another moral hazard here. But I'm curious for anyone who is watching live right now, what do you think about this? Do you think that 23andMe should be doing this in general? Is this the greatest thing ever, or is this an invasion of privacy? Let me know if you're not watching this live. Let me know in the comments. So, what we're seeing here is the first time in the pharmaceutical industry that a pure data mining company is now providing, now they now have enough genetic research done to create real live medicines. And I think this is really interesting because there are a surprisingly large number of companies out there today that have a lot of data on people. And it makes me wonder what kind of opportunities might be out there with data that hasn't even been thought about yet. So if you're in that kind of industry where you have a lot of data and you could see potential links to, for instance, maybe you have a lot of data on weather and human diseases in a certain geographic area. You could start looking at data around that and potentially find the causes of some of these long-term degenerative diseases, any sort of inflammation. I don't believe that many people are actually doing that specific data mining yet. So that's something to look at if you are a tech all-star or someone who's just incredibly smart. Start thinking about the kinds of data sets that you might be able to put together and the things you might be able to find and how that might turn into an opportunity for you. Now, not everyone has pro data mining skills, and certainly 23andMe has been at this for quite a long time. And so they really are going to have opportunities here that people without the data don't have. But there is a broader trend going on here. And so I found this Investors Business Daily article. And what it says is that after a sizzling end to 2019, biotech stocks could soar in 2020. And it says, well, I'm going to skip some of the fluffy stuff that they start with. But this article goes into a thesis that many investors are forming around the fact that CRISPR could grow tenfold as a business by 2026. So what they are predicting is that this class of gene editing drugs called CRISPR, which for those of you who don't know, is it's sort of like you have your DNA here, and it's you just like snip here, take it out, and then replace it with something else. And it's done. It's like this, from what I understand, it's like a pretty much perfect solution. Very interesting. And the earlier that you can get it into a human being, you can get rid of any disease, so long as they've found the CRISPR elements that are linked to whatever disease it is. Many inflammations are going to be associated with this. Many degenerative diseases, including degenerative muscle diseases, and literally every cancer will be linked to this. So what scientists are working on right now, and this is really the biggest holdup in CRISPR right now. But what scientists are working on right now is the method for actually introducing the CRISPR enzymes into a body. So it's like if you just take it in a pill, it's very ineffective. So what they're trying to do is find the right entry mechanism so that like someone who's older can actually benefit from this. If you're a newborn baby, my understanding is that it is currently possible to perform CRISPR procedures, although I'm not sure that it's legal at the moment, and definitely not in any sort of mass scale is it legal. But as this goes forward, and this is really, when I talk about the legality of this, many people don't care, right? So this is also an ethical question around biohacking. I actually met a guy last night at an event here for CES. And I was at this event with maybe 15 of the world's top CEOs in the AI and automation space. Very, very cool event to be invited to. And I was asking about different topics. One of them was ag tech. One of them was, that's an industry that I'm really interested in. But I got into this conversation towards the end of the night with a gentleman named James there, whose son is 18 years old, and he is biohacking in his house as a hobby. This kid is brilliant. That's actually not his only majorly advanced tech hobby that this child has, or I can't call him child if he's 18, but that this man's son has. And so it was really interesting for me to hear that he's interested in biohacking. And I've read many reports online of other people who are also doing this at home by themselves often. And on the one hand, this is going to lead to major scientific breakthroughs. On the other hand, someone who has bad intentions is going to take CRISPR and turn it into a major disease that quickly spreads across the world. So these are the things to really be thinking about. And what my thought here is we can't let the doomsday scenario hold us back, but we need to be aware of it. And we need to be conscious of how we might protect ourselves in the scenario that those things happen, because they will. And so when we talk about, the fears that people often have associated with AI, right? A major fear is that AI is going to get so intelligent that humans' purpose in the world has been served. And now the highest good that AI has is to either save the planet or, if it's programmed by someone who's just malicious, have a malicious purpose to destroying human race. But anyway, these are just many different ways of getting at the fact that AI could potentially destroy humanity. And CRISPR is the same way, and possibly more near term in that, because the AI industry, I was talking in another episode recently last week about the difference between general AI and purpose-driven AI. What we have today is purpose-driven AI. And the more that you dig into talking to people who are in the AI field, you very quickly learn that we are very far away from general AI. It's just a very hard problem to solve. And what that means is that the AI robot can figure stuff out on its own. And by the way, for those of you who are tuning in live, give this video a like, and most importantly, hit me up in the chat. Let me know what you think about these topics. And at the moment, I'm most interested to hear if you think that CRISPR is potentially going to cause just massive health outbreaks at some point in the next 10 years. So thank you for joining. And for those of you who are catching this in the non-live version, catching this in a replay, start joining our live streams. So make sure that you subscribe and click the notification bell to learn about when I'm going live next. I'm going live every Monday, Tuesday, Wednesday, and Thursday. So today is going to be the last day this week, but I'll be back here on Monday. So I appreciate you. Moving back into the topic at hand, this concept of CRISPR is just, first of all, it's going to be one of the fastest growing business segments we have. And they actually, in this article, show a graph here that shows how CRISPR in 2017 was a $551 million industry in 2017. And in 2023, which is only 3 years from now, it's predicted to be a $3 billion industry. So we're going 6x in a matter of 5 or 6 years here. That's pretty fast. And it also goes more broadly into these industries of precision medicine and overall cancer treatment. And the overall cancer treatment one is just going to be really big. So why we're covering this when the actual purpose of this talk today was 23andMe is I want to make you aware of the broader trends that are happening here in biotech. And so if this is something that interests you, first, if you are a youngin, meaning like someone who doesn't have their career kind of boxed in somewhere already, this is an industry to really be looking at because we're seeing very obvious breakthroughs starting to happen. And it's a hard industry to get into. It's easiest when you're just graduating college, actually. And so if that's the position that you find yourself in right now, and these are interesting topics to you, CRISPR, gene editing, the perfection of the human race done through medicine and not meditation being a much better way, this is a big industry to go into right now. And it's consistently on the top 5 lists of the highest, what are predicted to be the highest growth industries of this decade. And cancer treatment is just so important too. I can't possibly think of one of the best uses of anyone's time. So, this is all stemming from the fact that genetics have come down in costs just by so much. 30 years ago, it was $30 billion that it cost to read all of the DNA in a single human. And I remember when that happened too. I remember that news article and they were saying costs are going to come down, and they did. Now today the cost is down to around $1,000, and experts say that it will cost $100 in the future. So you can imagine what's going to happen here. There's another really cool invention that's being worked on right now that I'll mention in all of this. And it's a toilet that can actually, it has sensors that can read your stool and pee samples daily, which might sound kind of gross, but it's actually an amazing thing, because what it's going to allow you to do is first have early detection of anything that happens. So, anytime you're going to actually need some sort of medicine, like those things are going to be diagnosed by your toilet and then delivered to you the same day on Amazon. That's where the future is heading. You're not going to go to the doctor like you do today, even though doctors will still exist. You will still occasionally go to a doctor, but this idea of like an annual checkup is going to turn into a daily checkup. And so really start to think about where that might go. What are the things that might be detected? What are the distribution channels that need to be formed? Amazon isn't going to be the only distribution channel out there. So if you're a tech entrepreneur thinking about starting a fast delivery of pharmaceuticals company, now might be a great time to start looking at that, because the distribution technology itself is getting there, and the real challenge here becomes regulatory licensing. So if you think that you have a plan to be able to get that licensing, then you might actually be able to be on the fronting edge of delivering these fast acting pharmaceuticals. So, and I have to think that, Amazon has they actually did just start a kind of like an on-demand pharmaceutical company, like where they deliver medicine to you, and it's like package, like this is Monday morning, this is Monday afternoon, this is Tuesday morning, and so on. And so instead of being like all these little, different jars that you have to remember, they're just making it something where you can open them on, take it like I take my supplements and move about your day. So technology is going strong in this area. And if you are thinking about starting a company in it, let me know in the comments. I would be really interested to hear where you think the opportunity is going forward. So with that, if you are thinking about starting a company, first, check out my book, MarketScience. This is a book that I wrote last year. It's a short ebook currently in draft form that I'm going to be expanding into a full book throughout this year. And this book really outlines a technique of taking the scientific method and introducing it into your startup kind of business creation method. So what it does is if you're at a stage where you're trying to find product market fit, so you're trying to see if there are actually customers for your product, or you maybe have early product market fit and you're now trying to grow your company. You're trying to expand it. Maybe, you have this early traction, but now you need to create more marketing strategies to keep the growth. This is a way to test those new strategies at a very low cost and figure out what's going to work very quickly. So it's really the secret to fast growth for a startup. This is a great time to be getting into pharma. What I hope for you is that you actually destroy the status quo of pharma. The current status quo is, how can we make as much money by not creating any real cures, but just creating treatments? I would love to see people in my generation and younger, so millennials, Gen Z, start to actually focus on cures. It's going to happen someday. And because think about how much longer humanity is going to exist, potentially millions of years. And so even if we've been in this period of, 30, 40, 50 years where the pharma companies are specifically purchasing the cures and then shelving them and then buying or creating treatments that don't even work that well, and doctors don't even know which one to give you. They take those and then they make as much money as they possibly can on them. And they work with the government to make sure that laws are enacted to protect that. So what I really hope from this next generation is that people start companies that aim to cure, and they really focus on putting people first. So if you're watching this and you agree with me, give this video a like. Thank you for joining. This again is going to be the last video of this week. And if you've been tuning in live, I really appreciate you. My goal is to grow this channel to 100 people watching it in the live stream by June 1st. So we have just under 6 months to go on that. And help if you think you can help bring new people in to watch this in the live stream, invite your friends, and we'll turn this into a little community of people who want to make the world better. Thank you so much for joining, and until next week. I think my computer froze. Thank you for joining, and stay visionary.